myself Rajita, and I welcome you all to today's session. So today again I have came with a new topic, that is the nurse's role and responsibilities in inpatient department. So first we need to learn regarding the inpatient department. So likewise we have studied regarding the role and responsibilities of the nurses in outpatient department, right? So we have also seen the outpatient department are basically the specialized area in a hospital setup which deals with the client who doesn't require a continuous monitoring or a hospital stay and admission to it. So now we are going to learn about the inpatient department. So the definition of inpatient department is it is a specialized unit in a hospital or in a healthcare facility where the clients are generally admitted for medical conditions which require appropriate medical and nursing care and attention, even a continuous monitoring. So I hope by the definition you are understanding that it is the setup within the healthcare facility where a patient may get admitted to seek the needed medical and nursing care. As well as in inpatient department, only those clients will be getting admitted who requires a extensive medical care as well as a continuous monitoring. So here we're going to read about the function of inpatient department first. So you have to remember the inpatient departments provides a highest quality of medical and nursing care. So you have to understand the client who are getting admitted to a hospital or a healthcare facility definitely have a severe or a moderate to severe disease conditions present. So a quality or a improved quality healthcare or medical and nursing care should be ensured by inpatient department. Inpatient department also make provision for the essential equipment like drugs or other medical equipment which needed to perform any medical procedure or the surgical one. So basically in inpatient department we are going to see in a hospital setup the medical professional would be using all the necessary equipments that are present. So here the client would be prescribed with medications as well as certain medical and surgical procedures will be prescribed to the client to manage the disease condition. Inpatient department also provides a very comfortable and desirable environment as a substitution for home for a certain duration. So you might have been heard that environment plays a very vital role in the promotion of the health or in the managing of the health, right? So whenever a client is coming or presenting to the hospital with diagnosed with certain disease, if they require admission to the hospital or if they require a stay in the hospital, so definitely the environment of the hospital should be very comfortable and desirable one. So basically in inpatient department, it is the role of the inpatient department to provide a very comfortable and desirable environment to the client as a substitution for home till the time they are under the medical care, which generally helps the client to improve their life and also it helps for the early recovery of the client. This also provide a suitable atmosphere for highest possible degree of satisfaction and which also promotes the healing of the client. Inpatient department also provides opportunity for education, training and research for all the healthcare team members. So as we have learned regarding the function of the inpatient care, I hope you are understanding the advantage of inpatient care is definitely it will be providing a very effective medical and nursing care to the client who are unable to manage in home care setting or in the community setting. Now, basically, inpatient department will be dealing with the client who are having a severely progressed disease condition. It also makes sure that the client is having a well recovering or high pace of recovery. So that is the way the inpatient department will be assuring a complete medical and nursing care to the client who is suffering from a moderate to severely progressed disease. So, as we have learned, the client will be seeking a continuous monitoring and treatment in inpatient department. So, as we have mentioned, although it is a multidisciplinary approach, but nurses here plays a very vital role in the ongoing monitoring and assessment, as well as maintaining a very healthy environment in the inpatient department to make sure that the patient is having a early recovery. So let us discuss now in detail regarding the roles and responsibilities of the nurses in inpatient department. So the first and foremost priority or prior responsibility and role of a nurse is assist the client to get admitted to the hospital. So often we see a client would be approaching to a emergency or to a outpatient department. Once the investigation and the diagnosis has been made for the client, then the client may suggested to go for a hospital admission or hospital stay. Here nurses plays a very important role to assist the client and the patient caregiver to finish the procedure of hospital admission. The next important role of the nurse in the inpatient care is the history collection and physical examination. Once they are assisting the client with the admission procedures, then the next client will be asked for the detail of their history, as well as a nurses would perform the physical examination before admitting the client to our inpatient department. So, our detailed history collection and physical examination helps the nurse to identify the signs and symptoms or the sufferings that the patient is going through. Depending on that, the assessment of the client's need will be done by the nurses here. Also, after assessing the need, the nurses here would be planning and will be implementing and evaluating nursing care, even the medical care that will be provided to the client. The evaluation will be always evidence based. So basically, nurses here in the inpatient department will be following a evidence based care approach. Next, we are going to see initially after admitting the client, after doing the initial history collection and physical examination, a nurse would be responsible to orient the client regarding the hospital policies, procedures, even the rules and regulations related to the hospital stay, and also they will be orienting related to the ward in which the patient is admitted. Orientation of the hospital environment also would be ensured by the nurse to the patient as well as to their caregivers. So basically, nurses would be also describing and discussing the procedures and policies of admission, hospital stay, discharge, even the visiting hours, even all the necessary information with the client and their caregiver or family member. Once the client is adjusted to the inpatient department or the hospital setup, next the nurse plays a very vital role to carry out the nursing procedures and administration of medication if it is prescribed. They also carry out essential diagnostic studies which has been prescribed or suggested by a physician to conclude the diagnosis of the client. While performing the diagnostic studies and throughout the medical procedures, it is a nurse's role to maintain the dignity of the client and maintenance of the confidentiality of the information related to the medical care and their disease condition. Once the conclusion of the diagnosis is made, generally a physician would be prescribing a medical therapy, or maybe they can prescribe the client to undergo a surgical technique. Now, it is a nurse's role initially to teach and explain the client regarding the disease condition, regarding the treatment procedures that has been prescribed by the physician, or regarding the need of the surgery if it is prescribed or if it is planned for the client. Even the nurses would be teaching regarding each and every medical treatment or the rationale behind it to the caregiver of the client. Here, nurses would be definitely playing a very important role while performing the procedures. They should explain each and every step to the client in order to reduce their anxiety. So nurses also would be providing psychological supports to the client as well as to the family members here. Most of the time, the clients will be admitted to the hospital setup and they will be away from their home setting, right? So it is a nurse's role to provide them a very warm and very calm and quiet environment to maintain or to reduce their anxiety related to the disease condition and medical procedures. Also, explanation of each and every step of the procedures, the rationale behind it helps the client to cope up with the necessary treatment. While admitted in the hospital setup, a nurse should also educate the client and their caregiver regarding a universal hygienic precaution. So they will be basically educating the client to maintain a proper hygiene, personal as well as environmental hygiene, in order to reduce the chances of the cross infection inside the hospital setup. Here, nurses are also responsible to administer medications with time. Also, they will be major or they will be playing the vital role to maintaining their nutritional status, their rest and sleep balance, as well as their exercise. So, all of the daily needs of the client should be met by the nurse in inpatient department. So, as we have studied regarding the general responsibilities of the nurses in an inpatient department, now we should study regarding the focused role of the nurses in inpatient department. So, the first and foremost role of the nurse is act as an advocate or patient advocate. So here in the inpatient department, a nurses plays a very important role as a patient advocate. Basically, whatever the treatment plan is, a patient or maybe the caregiver or the family members would be included, and the nurse have the responsibility to involve the patient and the caregiver in the treatment plan. Also, they will be helping them to identify the nurses or the client's preferences, as well as it will be also helping them to involve in the decision making and for the treatment procedures. Next is advocate the client preferences to the other healthcare team. So it is a very essential role of the nurses to communicate the preferences to the other healthcare team member in order to provide a very effective health care to the client to manage the condition of the client. Next is the nurse plays a very important role in the communicator. So basically, nurse should maintain a well-versed communication with the healthcare team as well as with the client and the caregiver. Here, the essential communication by the nurse, which will be definitely preventing many accidents and incidents, which will be also helping for the early recovery of the patient in an inpatient setup. So the next role of the nurse is here documentation. So documentation here plays a very vital role. So a proper documentation should be done related to the administration of medications, the diagnosis of the disease condition, the treatment procedure that has been planned for the client, as well as planned surgical procedure if there is any. The nurses also will be maintaining a documentation related to the planned nursing care and the expected outcomes. The necessary diagnostic studies and the findings of it also should be documented by the nurse in an inpatient department. Next, nurses plays a very important role as an educator towards the client. So educating the client regarding the hospital policies, the stay policy, the discharge policies here plays a very vital role initially. So as we have studied that once the client is approaching to the inpatient department, it is a nurse's role initially. Now, orientation towards the hospital environment plays a very vital role here to boost their positive outlook towards the hospital setup, as well as it helps the client to gain the confidence over the medical professionals. So that is the reason the orientation of the hospital and their policies and environment plays a very vital role to manage the anxiety of the client as well at earliest. So often the nurses will be teaching the client and to the caregivers regarding the lifestyle changes or the lifestyle modification that is expected to ensure a early recovery and the prevention of the progression of the disease. So it is a nurse's role in an inpatient department to educate the client regarding all necessary lifestyle modification. Also, nurses plays here a very important role to educate the client regarding the treatment procedure that has been planned and the rationale behind the administration of it. Even nurses here would be educating the client and their caregiver priorly about the proper follow-up after the discharge is being done. Next, the nurses here plays a very important role as a counselor even. So as we have mentioned, the client here will be away from their home. So it is a nurse's role to provide a very well-versed psychological support to the client so that they help or they achieve a early recovery. The nurses should assist and guide in the decision making of the client. And also, the nurses would be helping the client to utilize all the resources that is available for the client in order to achieve a early recovery and will get discharged from a inpatient department. So nurses has a very vital role as a counselor here to maintain the psychological status of the client in an inpatient department. The next role of the nurse inside the inpatient department is as a manager. So definitely in an inpatient department, the continuous monitoring of the client will be done by the nurses. So nurses have the major role to plan, organize, direct and control the nursing care, even the medical care and procedure in order to promote the healing for the individual client. They will be also managing the staffing pattern, the behavior of the conduct of the staffs towards the client, which basically helps to improve the quality of the medical and nursing care that is being provided to the client. The next role of the nurse is as a motivator. So here, as the nurses and the patient will be having a direct one-to-one contact, it is a nurse's role to play a very vital role of motivator for the client. So basically, they will be having the essential role to motivate the client to adopt a healthier lifestyle in order to achieve the healthier state of life. So they will be assisting the client to make use of all the resources that is available, and also they will be helping the client to change their habit in a positive way. So the next role of the nurse is as a critical thinker. So we are going to see the critical thinking helps the nurse to solve the issues in a easy way and also with the available resources. So a nurse who is working in an inpatient department definitely should have the critical thinking ability in order to manage the client in an effective way. And also they will be helping the client to promote their health within a healthcare setup. Nurses here also plays a very vital role as a researcher. So basically nurses will be collecting the data in order to improve their nursing practice. They will be also provides the evidence-based practice in order to manage the client in a healthcare setup. So basically the research studies will be done here for the client and with the cases for improving the nursing practice and education. Even the research would be helping to improve the quality of the nursing administration. So even we are going to see in inpatient department, nurses have a huge role to provide the bedside care. So as I have mentioned, the client would be admitted to a hospital setup. Now it is a complete nurse's role to make sure that the clients are comfortable. That is the reason the assessment of the need of the client will be done initially and the nursing care would be providing dependent on the client's need. That is the reason the continuous monitoring and assessment would be done by the nurse for the client in order to make sure that the clients are met with their personal and physical need. Psychological need also will be made by the nurses for the client in order to promote a early recovery. Next role of nurse is very important is the training, educating and maintaining the inventory in an inpatient department. So basically the training and educating to the junior staff nurses as well as the nursing students plays here a very vital role to manage the complete healthcare setup effectively and to provide a very effective health care to the client to manage the condition what the client is suffering from. So maintenance of the inventory also comes under the management role of the client, which makes sure all the resources are readily available in a healthcare setup to provide essential nursing and medical care to the client who is admitted in our inpatient department. So I hope till here you have completely learned regarding the each and every aspect of inpatient care, as well as the role and responsibility of the nurses in inpatient care. So I hope you have enjoyed the session. Thank you so much for attending the session. We are going to meet you guys in the next session.